which is a very low fat content. But even that is fat compared to curd cheese.
Okay, good. Um, Now, a common theme on many people asking questions and writing in was this issue with the Coumadin. And I'm wondering if you can review that again. The typical recommendation, of course, is that by conventional medical physicians is to avoid all vitamin K generically when taking Coumadin because it will interfere with the ability of Coumadin to block the clotting process and therapeutically interfere with the mechanism so that they would be susceptible to some damage and clot that could potentially kill them. So I'm wondering if you could comment on that, the precautions, and is it ever therapeutic? I guess the big issue is that one of the risks of people taking Coumadin, I mean, and from those of that not aware of that, its other name is warfarin, and it's actually used as rat poison because it's very effective at doing that. And one of the side effects is it damages your bone density. So I'm wondering if you could take if your recommendations for the vitamin K2 to use that to prevent or impair not only the damage to the bones, but some of the other things you talked about, which is the arterial wall calcification and some of the neurological issues.
Yeah, well, there are 2 points in your question. The first is, can you limit the adverse side effects of Coumadin by vitamin K2? And there I have to say I don't know. I don't expect it.
Really?
Coumadin is a very powerful drug, and I don't think you will be able to overcome the induction of calcification in the vessel wall. Coumadin induces calcification of the vessel wall anyhow, but whether you can prevent that with extra K2, I don't know, because if you give extra K2, it means that you also have to adapt the level of coumadin intake, so you will have higher medication. So this, at least it is an open field. It has not been explored in a scientific way, and I don't want to comment on that too much. The other part of your question is it dangerous for people on Coumadin to take vitamin K supplements? Most medical doctors say, well, you should have your vitamin K intake low, and I don't agree so much. You never can make it zero. You have always a vitamin K intake, and the point is that it should be constant. And on the basis of this constant intake, the doctor adapts the Coumadin dosage. So if you have a higher intake, but it is a regular intake every day, then there is no problem, no harm done. And even if you have a relatively high K intake, you get more stable levels of anticoagulation compared to a situation where you have very low K intake and small disturbances have already a large effect.
Okay. Well, that certainly makes sense. Why don't we progress now to the issue of the vitamin K as it's affecting you commented on it previously, was the impact on the brain and the neurological conditions that it could impact on.
Yeah, but that's still very much hypothetical, huh?
Okay, but I think you had quoted previously some research that was just published in Germany. Was this?
That was research on cancer prevention.
Oh, cancer. I'm sorry, mixed it up.
Yeah, that was cancer prevention. Yes.
Okay, so at this point, it's just too early in the game to make any speculations as to what vitamin K2 may have. I mean, there's probably no person more qualified in the world to make that speculation than you. So I would be interested.
No, I do expect that in the forthcoming, say, 3, 4, 5 years, we will see surprising new effects of vitamin K, and that may probably also be in the brain. But the data are still not, conclusive. I don't want to speculate on it too much.
Okay, all right. And would that be a concern that you might interfere with some of the research going on? And make it...
No, but I want to maintain my credibility.
Okay,
you know,
all right.
and so I will comment on facts and not on speculations.
Okay, well, that's good. Do you think that it may have any impact on multiple sclerosis, like we see with vitamin D?
I'm not aware of any data on that area. No. no, no.
Okay. All right, that's good. And with its impact on arterial calcification, peripheral artery disease, um, can you comment on the doses? I'm assuming this is mostly vitamin K2, not the K1. And so what type of doses would someone need, and how long should they be on it? Is it a lifelong regimen, and what time frame might they expect to see some improvement on that?
Yeah. We have the population-based studies where there's no intervention, but just recording of the food intake, and there you see a spectacular effect of intakes, say around the order of magnitude 45 micrograms per day. And that gives already a nice effect. But this is, of course, lifelong intake. And it's not something like, oh, I'm now 50 years old and I want to do something for my heart and I will start taking a supplement. Well, it may be that you need more there. We are presently running a clinical trial to find out whether a certain amount of K2 will be helpful in the cardiovascular area. But this has not been completed. It takes 3 years to do such a trial, and we are only in year 1. For the short term, therefore, we have looked at certain blood markers. And we have asked ourselves, what is the minimum amount of K2 to see a significant effect after 6 to 8 weeks of intake, and there you come up again with this magic 45 micrograms a day. So then you see at least a significant effect, but it is not the maximum effect. A maximum effect you see at 180 micrograms per day. So then you have your blood markers say in the changed in the most positive way you can expect. And that is for the healthy population. If you are a patient, then I can imagine that you even need more.
Mm-hmm. So do you think that there's any additional benefit for say taking 100 grams of natto, which would have close to 1,200 or over 10 times as, or close to 10 times as 185 or microgram quantity you recommended?
Natto is just a food, so you can eat it without problems, without limitation. But I don't think you will be doing this every day. At least maybe less than 1% of the American population will think it's a nice experience.
Probably less than 1% of 1%, more than likely.
Yeah, sure. So maybe you are in a good mood and you think, well, okay, I will start taking natto for my health. But after 2 or 3 days, then you are sick of natto. You will not be able to continue on that line. But I think there is no problem. I think natto is a healthy food. It is the right form of vitamin K2, so it has all components that you should have.
Okay, so there's I guess the intention of the question was not necessarily from natto, because you can certainly get it from supplements where people can take that every day at the same doses. So do you feel that there's potential benefit if someone has a severe form of arterial calcification or osteoporosis, that there may be additional benefit to taking a dose higher than 185 micrograms per day?
Yes. The ultra high dose of K2 is a subject that we may enter in one of the forthcoming years, but at this time we are focused on nutritional doses, and nutritional is what you can get with a normal Western type diet. And that will be, say, up to about 100 micrograms or so, and that's a nutritional dose in my view.
Okay, and that's typically available with anyone who's eating a significant amount of cheese, whether it's curd or regular cheese.
Yeah, exactly. Okay. Yeah.
That is just really an interesting. I did not understand that prior to you're expanding on it, so thank you for sharing that. Just finishing up on the natto, there's another supplement I'm sure you're familiar with. It's called nattokinase.